With any particular activity or any sport, any exercise type of activity, if you get to a point where you are becoming more and more intense with the activity, injuries are an eventuality. It happens. And what you want to do is you want to minimize the amount of injuries and the severity of the injuries. You want to make sure that you have a prevention plan in place. Well, the three common ones that we will be talking about in this session today is plantar fasciitis, shin splints, and potential pelvic imbalances. Those are three very common ones that I see coming through the doors. So basically, the plantar fascia is a ligamentous tissue that runs from the heel to the toes. And what can happen at times is that it can become overused. And for example, somebody who runs maybe on uneven surfaces, there's more strain on that one particular foot. The area around the heel becomes very, very tender because of the overuse. So a couple of possible signs and symptoms that a person might be suffering from plantar fasciitis is the general tenderness around the inside of the heel. That's one. They feel it and all of a sudden it's very, very tender and very, very sore. One of the key indicators for myself is that when a person tells me that when they get out of bed in the morning, as soon as they step down, they feel a significant amount of pain in the heel. And as the day progresses, what happens is that pain tends to fade, but keeps returning in the morning more so. So in other words, like the pain is more significant when they wake up and they step down, but as soon as they start walking and they start moving, as soon as the tissues become warmer, what will happen is that the pain tends to fade a little bit. So basically, shin splints is a layperson's umbrella term for pain that's around the front of the lower leg, so around the shin. So obvious signs that there's potential for shin splints when a person comes in is the most basic sign of pain at the front of the shin. So what might happen is I might poke around the front of the shin there and there might be a lot of tenderness. Also, there tends to be a lot of tightness from the calf. Later on in future segments we'll talk about shin splints more specifically, and we'll talk about some of the things that could cause it. So simply, a pelvic imbalance is when you have, for example, one side of your hip that's higher than the other. Maybe your pelvis on this one side is rotated more so relative to the other other side of your body. You might find that maybe there's different levels in terms of the way that your pelvis sits, and because of that, it can cause a lot of issues such as with your lower back, your hips, potentially pain down into the knee and into the ankles. So some of the symptoms that a person may encounter if there is a potential for a pelvic imbalance is that they may have, for example, lower back pain that's been diagnosed. They get treatment for the lower back, but the lower back doesn't seem to be getting better. And what that indicates to me is that there's a potential for something happening outside of the lower back that's causing the aggravation in the lower back. It could be coming from the front, from the hip flexors. Another common one is that they might find that they get injuries on one side of their body more so than the other. So like, for example, some people have a tendency to have left-sided issues. So they might have a problem with their left knee, problem with their left hip, problem with their left ankle, maybe problem with the left side of the lower back. So whenever I get something like that, it gives me a clue that there's potential for a pelvic imbalance. They may be complaining of one particular thing, but it could be because there's that imbalance causing compensation in the area, causing the person's symptoms.